Hi, everyone. Thanks for joining us for this webinar today on chronic pain and diet. I'm here with registered dietitian Jenifer Tharani and health coach Linda Downey to talk more about what diet has to do with chronic pain and different types of dietary approaches designed to help improve overall well-being and quality of life. So really appreciate you being here. Before we get into the discussion, just want to share a little bit more about our guest today. Jenifer Tharani is a registered dietitian at Rheumission, where she is an anti-inflammatory nutrition and lifestyle expert and daughter of a chronic pain warrior. Jenifer completed her master's degrees focusing on probiotics from California Polytechnic State University and anti-inflammatory nutrition from Texas State University. She believes in helping patients living with autoimmune conditions with making small, sustainable lifestyle changes to help improve symptoms and overall quality of life. And Linda Downey is here. She is a health coach with Swing Care, a specialty clinic for comprehensive fibromyalgia treatment. Linda is board certified as a health and wellness coach and lifestyle medicine practitioner with over 20 years of experience helping people manage chronic pain through lifestyle approaches. So I think we have a really great team here today to discuss what diet has to do with chronic pain. And to kind of get started, I'm curious about, how you both started working with people who have chronic pain conditions and, what some of the different challenges maybe were for those clients compared to other clients that you've worked with in the past as a health coach and a dietitian, respectively. And maybe Jenifer, we can start with you.
Sounds good. So I started working with people with chronic pain because, like you mentioned in my bio, I'm a daughter of chronic pain warriors. So my mom struggled with chronic pain almost her entire life without a concrete diagnosis. And when COVID happened, I was working at an endocrinology clinic, but I just was like, okay, like there's also this whole thing that I have, as in my back pocket, which is expertise, obviously as a dietitian, but expertise in anti-inflammatory nutrition as well as gut health. And it clicked me that patients with chronic pain are not getting the right nutrition advice, or there's so much, misinformation out there. So it was just like like those intuitive moments that you get, right? It was that led me to actually also start working with patients with autoimmune conditions who have chronic pain as one of their symptoms.
And Linda, how about you?
Yeah, so I started out as a massage therapist and a yoga teacher, with pain being the most common reason that people would come to my class and to my clinic. So, with 21% of people in the United States experiencing chronic pain, and 8% of those people whose chronic pain is severe, it's been a journey to try to figure out what resources and support that I can offer. It's been a personal journey for me as well, and I wanted solutions that were supportive for my health overall. So I think it's pretty exciting to see what research is finding as far as solutions and resources for chronic pain. 20 years ago, the recommendations and practices that I had to make weren't thoroughly studied. And this is changing. Now we can direct our recommendations for patients based on evidence. And so it's a really exciting time to be in the field because confidence is much higher in terms of the recommendations that we can make for patients.
In doing my own research, because as a dietetic intern, none of my rotations included, learning about medical nutrition therapy for autoimmune illnesses because there isn't one. And to kind of go back to your question early on, is where you said, what are some of the challenges that you experience in working with clients with chronic pain versus those who are, let's say, struggling with hypertension or diabetes or obesity, right? with those conditions, there is a pretty straightforward approach to, managing these conditions. We have specific medical nutrition therapies for these particular clients, right? But when you're working with chronic pain patients, there isn't a very straightforward, like, this is the medical nutrition therapy, these are 5 steps you take and you're good to go, right? So I feel like there is that huge challenge, but it's a good one because that pushes us practitioners to take a more individualized approach with these kind of patients because there's so much going on with them. That you have to address, like as a health coach, that I'm sure Linda does, and as a dietitian, really honing in on their diet and lifestyle factors to help them overall.
Yeah, it's interesting. And when I talk to folks who are kind of working, especially on non-drug approaches for fibromyalgia, like we work on here at Swing Care, it's very, it's an N of one. They are their own kind of test subject, and they often don't have people like you, both who can kind of help them along on that path. So I'm really curious about how you do that. But before I jump into that, Jenifer, you actually mentioned, countering some of the misinformation out there that you hear. I'm just curious. I know we didn't talk about this beforehand, but was wondering, like, what are some of the kind of myths maybe you hear from clients that you work with, or yeah, biggest kind of misinformations out there that you might want to tell people don't follow that path?
Yeah, absolutely. One that comes to mind is a huge one. And, there's that nuance to this approach as well, is going completely vegan or vegetarian, right? If you have like ethical reasoning behind that, I completely support that with my client, support my clients with that. However, for your particular disease management approach, I feel like it's very extreme to eliminate a lot of food groups without really having the support of a dietitian to make sure that you're replacing those eliminated food with proper macronutrient containing foods that include, fiber sources, protein, healthy fats, all of those things, right? So it's that, right? Like, eliminate everything and then have such food fear around reintroduction, and then you have no support, um, and then you're just in that space where you're not reintroducing anything, but also struggling with micronutrient deficiencies and also struggling with very many symptoms that you started off before you did the elimination diet, right? And then all of these random things, right? Like, have celery juice, which again is great. It's can be a part of an anti-inflammatory eating pattern. However, just relying on that as one of the ways, or rather relying on that as only way to lower inflammation, can be harmful. There's so many eliminate sugars 100%, right? Like, and I think that's where the nuance comes in, is like, okay, we cannot eliminate 100% of sugars, but how can we make sure that our diet is contains very little added sugars? So I don't know, the list is so long.
Well, this is good news. I feel like it's what you're saying seems to me like a very non-extreme kind of approach. So like excluding the extremes is helpful. And as someone who has a bowl of chocolate chips by my desk, I appreciate the inclusion of some sugars. But so let's say someone is starting off with the support of someone like you both. Before we get into that, I'm just curious, Jenifer, we've mentioned the kind of anti-inflammatory diet. Can you tell me more about like what that is? So we're not going vegan or vegetarian necessarily, but I assume you do exclude some things from that. And what does that look like?
Yeah, so there are different approaches for different types of patients. So the first approach is more sort of like an anti-inflammatory eating pattern approach, right? There's a lot of evidence to support the Mediterranean eating pattern, and then just an overall plant-based or plan forward dietary pattern. So a lot of patients do not want to go through the elimination protocol, which I'll go into a little bit of detail in just a second. But just with this overall diet itself, I find that the symptoms can improve largely because there's always those gaps in nutrition, right? Like I say, like, okay, let's just go back to the nutrition basics, right? Like, what are those pillars? What are the pillars of anti-inflammatory eating pattern? And a more recent study that actually was done, it's called Plans for Joints, is such a great example of this. It was a 16-week randomized controlled trial. It was a multidisciplinary lifestyle program. It showed substantially decreased disease activity and improved metabolic status in people with rheumatoid arthritis, with low moderate disease activity. So again, just to emphasize on the fact that we don't have to go extremes, but I always tell patients is look at the gaps and look at the things that you can add, because once you start adding, your taste buds will change. You're gonna crave more of the whole foods. You're gonna learn to, like, flavor your foods with more things like herbs and spices versus just salt. And overall, you're going to start experiencing symptom improvement, which is going to be a huge motivator for you to even create a foundation for the next phase. That just gives them so much freedom, knowing, because they are also mindfully aware that, oh, actually, Google said this, but my body isn't saying this. So basically collecting a lot of data from your own body in response to foods, and then only keeping those trigger foods out of the diet and reintroducing as many foods back into the diet.
Yes, thank you. And kind of taking a step back for a second, you mentioned that kind of that connection between, the gut and using this protocol to kind of help the gut heal. What is the connection between the gut and pain, especially in kind of autoimmune conditions like you work with? And yeah, I was wondering if we can get into the science of that a little bit, because I don't think it's necessarily intuitive.
So of course, as a health coach, my strokes are a lot broader. I'm not making medical dietary recommendations. Working in a team with a nutritionist is fantastic for that level of support. But just in kind of like a broader context is this idea that there's a relationship between the gut and the brain. And a lot of basically the contemporary way of examining pain at this point in time is that pain is an experience in the brain, right? So you have these stimuli in your body, but it's your brain that's interpreting what to do with it or what it means. And so there's a total relationship between the health of the gut and inflammation in the brain. And food choices and healing that gut, go a long way to lowering inflammation, not just in your tissues and in your belly, but literally inside of your brain. And so the ability to lower inflammation in the brain allows for healing to take place in the brain and for your brain to be able to develop new connections, so to speak, right? So the building blocks for cognitive awareness, reducing brain fog, healing and recovering, the ability to make those connections and just focusing at kind of a lower alert level overall is a powerful, powerful role of an anti-inflammatory diet. I love what Jenifer talked about, which is that, you want to be mindful of getting too extreme and like taking things out or like, you know, um, missing out on certain types of nutrient families. So the way that I end up working with patients and clients a lot is about adding in more than it is about taking out. And especially because like you can retrain your palate and your taste buds to love new food, right? So it's just like baby steps, trying to add in one thing. And especially like with a population, where there's fatigue and brain fog and concentration issues and a limited amount of energy in the week. Taking on massive dietary changes just feels overwhelming. And it's easy to kind of give up on it. So it's a lot more successful to just, pick one change at a time, um, and say, like, I'm gonna hydrate better. Like that's going to be my theme, and I'm going to remind myself, and I'm going to, create little tie a yellow ribbon around the faucet or, something, the doorknob. There's all different kinds of ways to create ways to engage yourself and remind yourself. So that to me is the idea. And I remember in training as a lifestyle medicine practitioner, even with, 20 plus years thinking about wellness, just the cognition and awareness that basically um, you've got a garden in your belly. So I just love this idea of thinking about my little garden, and I've got to cultivate my garden. And it made a totally different perspective for me on fiber, right? Plant-based fibers. Because 95% of people in the United States do not get the recommended amount of fiber in their diet in a day, in a week, and in a year. Um, and I thought, oh, okay, well, that has to do with like my colon health and my digestive prowess. But actually, I've taken on a different perspective than that because that's the food for my healthy bacteria in my body. It's not so much about taking in a new dose of probiotics, and eating sugar and whatever, might be detrimental to them. It's about cultivating the healthy bacteria that I've got, and supplementing that, right? But primarily using that fiber and those plants, not just to feed myself and to create, but to feed that biome, and having a flourishing garden, right? Where, like Jenifer was talking about, the walls of your intestines can heal and function the way they're supposed to. And then you're less reactive to different foods and even things that you might have been triggered by before. It potentially, like, it's an evolutionary process. Like you'll be less reactive when you can kind of shore up creating the right environment inside yourself.
I love that kind of cultivating your garden metaphor, and I appreciate you kind of connecting the dots here because we're talking about different things, autoimmune conditions and fibromyalgia, which is not classified as an autoimmune condition, but does have that kind of neuroinflammation aspect, and that then contributes to brain fog, which so many of our patients say is one of the most intrusive things in their lives. And so being able to connect the dots there and understand why this kind of approach might be beneficial to a variety of different chronic pain conditions is really helpful. So thanks for that. Wanted to just touch on this idea of fiber and other things that we're often very lacking. And I know, Jenifer mentioned that there's no one size fits all approach here. We're all being very personalized with this approach, but are there things in general that either of you kind of recommend to your clients to look at increasing more of, or increasing or decreasing their consumption of?
Yeah, definitely. And to Linda's point, I cultivating that gut microbiome, and also, like, really nurturing the garden so there's more diversity in gut bacteria is really, really important. So along those lines, prioritizing anti-inflammatory diet pillars. I'm a huge proponent of beans and lentils. They're so underrated, but they're cheap and less expensive, but they're an amazing source of soluble fiber, protein. They feed the gut bacteria. So I just absolutely love them. And again, you don't have to eat them every single day for every single meal, but just even making a small goal around including them 3 to 4 times a week because we have 21 meals. Even 3 to 4 meals with beans and lentils can go a long way. Nuts, seeds, omega-3 fatty acids. So definitely our favorite fruits and vegetables, olive oil, herbs and spices. Herbs and spices are also so underrated, but me as a South Asian, like we use so much of it that it comes naturally to me. But when I kind of evaluate clients' diets, it's not used enough. So just that, and then matcha tea, and like Linda said, an amazing thing about hydration, like water. We shouldn't forget water is so, so important. It can be a really good start. I just tread cautiously when discussing supplements, just because it needs to be individualized. In terms of avoiding foods, I say keeping intake of fatty foods, added sugars, high sodium containing foods, and processed foods to a minimum can be a really good start. And then avoiding alcohol or just sticking to wine as the choice of alcoholic beverage. Again, if it's not a trigger, as well as then also eliminating your identified food triggers are some of the things that I would definitely keep in mind. But like Linda said, focusing on addition first is a big step.
Yeah, and let's talk about kind of practically making some of those changes. So, Linda, I know you mentioned kind of the example of like having a ribbon on your whatever water bottle. I don't know. When you're thinking about adding things in, and maybe this is different than removing things, when you're thinking about adding things, what are some of the recommendations you have to help that behavior change? Because we know, especially, Jenifer mentioned you're doing all of this on top of the symptoms you already have from fibromyalgia or RA or something. So how can we do that in spite of, these symptoms that are maybe flaring on a given day?
Yeah, so that's a great question. Again, I think it's like baby steps. I think that, I think we like all of us as human beings, we're just like, okay, on Monday, I'm gonna throw everything out of the cabinet and I'm gonna start, I'm gonna eat like a Japanese macrobiotic diet, but like all of the meals that you know how to cook are South Indian or Mexican. Like I think there's definitely ways to celebrate your own cultural diet, and to just kind of upscale those. So again, as a health coach, I'm painting broad strokes with people, and it's like, I'm inviting people to consider and brainstorm around like how do we introduce the most whole food?
Right.
What is it that you're going to add in, where you're going to add in like something, close to its original form, and kind of de-emphasize those things that have gone through a lot of processing. And I think that theme is kind of like a simple one to apply. And the beauty in that is that the closer the food is to its whole form, the less work it is to prepare it, right? So you can literally wash some carrots and eat them, and you're doing something really great for your health. Um, not everybody's at that place in terms of their palate. So sometimes it's like a little bit of trial and error and figuring out, what's the exciting next step or what can someone visualize as possible for them. So like let's just take, like in a Mexican household, there's like Spanish rice. So like inviting the person to make the Spanish rice with brown rice instead of white rice. Um, another thing is um, setting aside some time every week where you just put your attention to your goal, right? And using that time maybe to create a grocery list or um, trying a pot of soup that you've never made before, when you're not stressed and you're not in a hurry and you can take a lot of breaks. Um, and then freezing it, some of it, in manageable sized containers so that you can pull it out of the freezer when time is tight and you're hungry or hangry, Right. So a lot of it can be, spent in just kind of creating a strategy around it and then setting up, little changes at a time. I mean, one other thing that I think is kind of important to think about is staying connected to your why can be a really powerful motivator in continuing along the path to creating changes, right? So people have a tendency, all of us, to start out strong and then lose steam or get discouraged when, a flare-up gets in the way or it's hard to remember. Um, but what we do in health coaching is we spend time kind of digging into that. And it's like, well, what is your why? And when you imagine yourself, like, what do you see as the benefit of making this change? Like, what do you want to get out of it? Um, maybe that's so you'll have less flare-ups so that you can play with your grandkids or feel good enough to go on a social outing with your friend. Or maybe it's to lower your absenteeism at work so that you feel like an effective, productive human and you're a financial contributor to your household. It's a very individual reason. Um, and we'll play with that. So like, getting to your why and then just going and finding a magazine photograph that represents that why to you. Or maybe it's a personal photograph of the family member that means the most to you that you're gonna benefit, that you're both gonna benefit from the changes. And putting that right smack in the middle of the refrigerator door. And helping you kind of stay connected with why you want to continue.
Yeah, I always come back to that why because I think there's lots of different, cool time-saving tricks and like meal prepping hacks and stuff that we can talk about. And we do have another webinar here at Swing Care about fibromyalgia specifically and food and lots of different prep tips in there. But also, I think what you're saying, Linda, is totally right, where, setting aside that time, even if it's just, 15, 20 minutes to connect with the thing that you're doing. And part of that is the why, right? And using that time because of the person that you want to be. And usually when we, talk about why we're not eating better, a lot of the time is a time-based problem. It is can be hard to fit that into your regular everyday routine. But if this is important to you, then spending that time to become the person that you really want to be, that's what we're all trying to do at the end of the day. So I love that you called that out. Before we wrap up here, I do just want to ask, around success stories that you've seen from patients or clients and something that they were able to accomplish, with some of these changes, or things that you did, that you worked on that you both felt really proud of together. Just curious about that.
Yeah, absolutely. There are so many, but one in particular comes to mind. This patient actually was struggling with IBS and had been on a vegan diet for a long time, without quite understanding why she wasn't feeling any better. I alluded to this a little bit in the middle of the webinar. She had developed food fear, was unable to exercise due to lack of energy, unable to enjoy social events due to IBS flares, causing arthritis flares. There's that gut joint pain connection and also brain fog. So, when it comes to IBS, we have a medical nutrition therapy. Fortunately, at least we can tackle that. And I know a lot of fibromyalgia patients also do struggle with IBS, and the medical nutrition therapy is the low FODMAP diet. This dietary approach requires elimination of high FODMAP foods, which include a lot of like plant-based carbs, protein, options such as beans, lentils, fructans containing grains, and some nuts, to name a few, right? So you can see that this is not a very straightforward approach. And if you're on a vegan diet, you're heavily eating a lot of plant-based fiber and foods, which are actually not doing any good to you in the short term, right? slowly reintroducing the high FODMAP foods and identifying triggers helped. So when we worked together, she was then able to um, overall get her energy back because of getting enough protein and then strategically keeping the low FODMAP fiber containing foods in her diet to also, make sure that the diet includes fiber. And then overall, within 3 months, she was able to exercise again, brain fog reduced, which helped with better performance at work, like Linda alluded to, is like, when you're able to be a more productive contributor to the family or in the work life, right? When you have less brain fog, more clarity, are able to make better decisions. She was also able to enjoy social events, travel with more tools in her back pocket than before. And most importantly, like her food anxiety completely vanished. And that was like my biggest thing for her too, is like this elimination restriction or being on the vegan restrictive diet had created so much food fear. So the food anxiety vanished, and then she started to feel more empowered with her food choices due to the awareness we built around her food and lifestyle triggers for flares. So overall, just improved quality of life, which is my biggest goal for my clients.
Yeah, so for those of us, for health coaches, the things that we really enjoy and get excited with our clients along wise is when people start to feel capable, right? So there's that like that sense we use the word self-efficacy, right? When you feel like you can see yourself being capable of doing something. And so within that is like that idea is kind of this idea of like an upward spiral of behavior change, where a little bit of change that you're successful at, and brings you the kinds of results you want, make it possible for you to see a bigger change or a different change. And with diet, I think in our society we think like of lack.
Mhm.
Um, that diet is a restriction and that you're taking something away and we as like the human animal, like we don't really like that. It doesn't really work so well. So I mean, when I think of clients, it's like it's the clients that are coming back to me, and telling me about their successes, and about the new thing that they tried, or or how they're connecting the dots between the changes that they made in their diet and their energy level, or a reduction in pain, right? And an increase in hope. So, you know, I think Jenifer, you're probably in the same camp as I am. It's like once you see food as medicine, you can't really go back. It's like, so we have these tools, and you mentioned a lot of that, like the spices, and the whole foods and cultivating our garden and that kind of thing. Like, it's when I think, when I feel that I've people are successful in making that journey is when they get excited to be on the journey. And it's a relationship where you're kind of recommitting to making those food choices because, we're making food choices all day long, every single day. Yeah, so for me, that's where I feel like I can get along excited alongside clients when they're able to bring diet on board as one of the, powerful ways of utilizing lifestyle medicine.
Yeah, I feel like feeling empowered is amazing, right? Like when they start to feel empowered around their choices and proud of their choices and start celebrating those wins can be really exciting.
Well, I hope that's a big takeaway that people have from today. I think there's a progression where people might not be aware that, diet can, be a factor, especially in some of these chronic pain conditions in terms of how we feel or how our symptoms present. Um, but then there is that kind of hump that people sometimes need to get over where, as Jenifer mentioned, there's that food fear, right? It's just like, okay, well, now I know that this plays a role, but am I doing it right? And like, what if these foods are actually not helping me? And so one thing that I hope people take away from this is, it's about that kind of reintroduction and finding the things and finding the strategies to incorporate more foods that make you feel your best and that make you, yeah, give you more self-efficacy, like Linda said. So I hope that people take away that lesson among others from this webinar today. Anything you'd like to share before we go with our viewers today?
Yeah, people can always find me on Instagram. I'll share the handle with you. It's minimalist autoimmune nutrition because I'm very much of a believer is simple versus complex anything, right? Like we feel like when things are complex and we solve the puzzle is where the joy is, but I feel like the joy is in simplicity, and that's what I'll say to our audience is, look for those simple approaches that are sustainable in the long term. And I'm sure Linda is an excellent coach on the Swing Care team to help patients with some of these simple goal setting and with this simplicity, instead of making everything very complex or chasing the challenges, because it's better to chase those simple steps, consistency, making them routines versus trying to solve a complex puzzle without really like looking at it from baby steps approach.
Yeah, Jennifer, I love that, that I mean the simple steps, right? And I love goals that I can succeed at. Under promise and over deliver.
Absolutely.
Makes you feel great.
Yeah, so as everyone mentioned, I'm a health coach here at Swing Care. And Swing Care is a virtual fibromyalgia clinic. We're a collaborative care clinic, um, specifically in support of fibromyalgia, and we have a team of health coaches here as part of the team. So yeah, we love to talk about behavior change all day long. So.
Yes. Yeah, so you can find us here at the Facebook group if you're watching it there on YouTube, and then also at www.swing.care. So hope you check us out there. And Jenifer at Rheumission, we have so many folks who have fibromyalgia in addition to lupus or RA or other autoimmune conditions. So please check them out as well. They have a great team there, including Jenifer. So thank you both for being here. Really appreciate you and look forward to talking more about food, nutrition, and other good things in the future with you.